Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I want to talk to you a while about the effects of mouth breathing. People don't realize the effects mouth breathing can cause on the whole development of the facial structure in here. And it goes back for many, many years with that. And I have to bring up something that I experienced while working in Nigeria for about 3 years. I went into this school. We had a mission deal, and I took care of people's teeth there. There were missionaries and everybody else that came in. We did that also, and they wanted me to go to this school and check all these children's teeth. So I came to that school with my whole crew of about 10 young men. We didn't use women to work in the dental office. It was young men, and we cleaned all these children's teeth and everything, and I filled all the cavities, and I think there were 12 cavities in the whole school. Nobody ate anything sweet. They didn't know what a piece of pie was, and so they had very little decay, and there was no child in that school that needed orthodontics. I took one supernumerary tooth out. Now, I've told this story several times before. This whole class, this whole group of people in that school, nobody needed any orthodontics done. What made the difference in these people? All right, the first thing, the African people didn't feed their children protein enough, and if they didn't nurse for about 2.5 years, they would take a disease called kwashiorkor, and their stomach would get as big as a watermelon, and they died. And this happened when the mother would have one child go along for about a year. She gets pregnant again, and she feeds the younger child, but doesn't have the older child have any breast milk, and they don't get any protein. And these kids that nursed for 2.5 years had perfect airways. They developed their airway good. I don't have any evidence of this, but you can't breathe through your mouth while you're nursing. I know that for a fact. And so you breathe through your nose, and you develop the airway growing up, and these people had developed airways. But in America, we give them bottles, we feed them quick. It's almost impossible for a woman to nurse a child for 2.5 years, something like that. And so we have a problem with that. Now that causes the airway to be less developed, and so if you have allergies, which a lot of young people do, they breathe through their mouth, and that closes the septum up. I showed you the septum up in here, and the turbinates swell up, and they block the airway themselves, and that's where it forces them to breathe through the mouth. And I have a little great-great-granddaughter right now that is developing a tongue thrust from a mouth breathing problem, and she's old enough to tell me that her mouth dried up, so she if she breathes through her nose, it doesn't dry up, but when she breathes through her mouth, it does dry up. So we're going to show you some effects of mouth breathing, and it causes the tongue to be on the bottom, and you breathe across the tongue of the top, and then your lower teeth will expand out more than your upper teeth, and the upper teeth doesn't get its upper arch doesn't get the pressure to expand it out, and so you have someone there with an underdeveloped maxilla, and the teeth frequently will become in a crossbite. Now here's a case, and there's just numerous kids with tongue thrust problems. But if you try to stop the tongue thrust, you ought to first make the airway bigger so they can do that. Now look at this this young man's teeth. He's tongue thrusting, and he swallows. If you got your tongue on the bottom arch, it's hard to come out of the infantile swallow pattern, and you tend to swallow and push your tongue forward, and that pushes the space out here, and it doesn't widen the maxilla like it should be up here, and you'll come out the end cusp, or even I've had lower teeth that fit out like this, and the upper teeth would be in like that. And these cases have a lot of mouth breathing. You'll have the teeth on the bottom just jump over the cusp, or they move out one way and somebody moves their jaw over and their jaw turns to one side a little bit, and the shape of the condyles are changed because of mouth breathing. And there's all kinds of things take place because of the mouth breathing. Now, if you mouth breathe and you tongue thrust, you push your tongue up here. Now I can swallow without biting my teeth together because I've shown people how to do that. But for me to do it, I have to put my tongue up here and swallow. But most of you swallow, you bite together every time you swallow, and that tells the teeth when they've come in the mouth far enough, and that's what develops this normal 1/3 of the face. If you have somebody who's tongue thrusting all the time, the teeth will not hit together enough, and so the teeth just move in the mouth further, and that makes you drop the chin, and the lower third of the face develops longer than it should, and this makes people look bad. If you look at somebody who looks this, their mouth may be needed to close a half inch, and you're a chronic mouth breather. His jaw drops down, and they have this long third of the face, and they actually, their blood oxygen level is less than it should be anyway. So you need to come in on a lot of people and separate the palate, get it way out there where they can, that will develop the airway, and that carries the roots of the teeth back. You can do that with a big daddy arch wire, but you got to put a rectangular arch in there and have root torque on it and bring the crown and the roots out to carry the airway out properly. Okay, here's this kid. Now, don't try to stop the mouth breathing problem. Don't try to break down the tongue thrust until you corrected the airway problem. It's almost impossible for that child to learn how to do it when they still have to breathe through their mouth. So that's the problem here. I'm going to show this case real quick. Now, it's not a chronic mouth breather, or the lower arch would be out past it. You can take somebody's model and look at it. That's a real chronic mouth breather. Now we can develop, this is a tongue thrust thing. We came up, I really like to put bands on these teeth down here and put these fingers on them. But we put the fingers in there to break the tongue thrust problem. But don't try to break the tongue thrust problem until you get the airway problem corrected. And don't go to an ENT guy and let him check your airways. Other times they'll spray your nose out so it'll shrink up, then you're breathing through your nose. But you don't run around spraying your nose all the time, or you'll get an allergy to that. So let's go through this. This is a tongue thrust device. It just is bonded on the inside. I don't like that kind, really. I like the one where you band these teeth down here and have these little metal things that go back to hit the teeth. But make sure they have airway open before you try to break this tongue thrust thing. So here we've got a child is pushing forward and back. I tried putting a band on there and building this, and it works okay, but it's much better to band those teeth and bond these wires on. And that's the most efficient way to break a tongue thrust that I know of. But make sure you've got the airway going. If you get the airway going, the child can almost forget about the tongue thrust. He'll breathe through his nose, and he doesn't have his tongue up there all ready to start with. So this is something to take into consideration. You just don't think about the things that a chronic mouth breather, how it affects the facial structure. It'll increase the length of this, and that makes you look stupid anyway, and so don't do it. Now, I am a partial mouth breather and push my upper teeth out where the cusp cuts together with the cusp of the lower teeth, and you bite your cheeks that way. And it's hard to correct the way they fit. So you could see somebody, if their upper teeth, let me just get a little clear space here, and say your lower teeth are fit together like this, and your upper tooth is coming down this way, going up. That's a mouth breather. See the tongue, see this upper tooth should be hitting this way. Now that keeps your cheek in out of the way, you don't bite it. Mine went back to where I was hitting right on this, and I suck my cheeks in underneath there and bite my cheek. So sometimes when I'm eating, I have to put food in the jaws to kind of hold them out like that so you won't bite your cheek. And so you can look at somebody, and if their upper teeth are inside here, now a lot of times they'll have one side will be like that, and instead of having the upper teeth come out and meet like this, they will shift their jaw so that the upper teeth are fitting here like this, and maybe the other side is different. And so people have cross bites develop simply because of mouth breathing. And so if you're going to expand this, they thought for a long time that adults couldn't have their teeth straightened. They can definitely have their teeth straightened, and you can widen anybody's arch. And these people with narrow arches as adults, you need to go in and widen their arches out so they can breathe properly in there. So I'm going to show you a way to do this. You have to do this. I'm going to clear this up and get another place in here. Now, if you use the Big Daddy arch wire, it's a big arch wire here. It has you can have all kind of lateral pressure you want using that arch wire. But so you want to really, when you spread out an arch, say the arch is meeting this way with the lower teeth out wider than the upper teeth in here, and the lower teeth would be coming up this way like this. And we want to widen these upper teeth out like this. You can come in with a large arch wire and you expand it and you bring it in. But before you start with that, you have to use a rectangular wire. Like if you take this tooth right here and you just pull on it here, the root will go this way and the crown will go this way. And this way, this doesn't spread the airway properly, and people don't realize that. You've got to put force on these roots to make them go out like that. Now, how can you do that? You have to come in, and I'm going to clear that up just for a minute, and we'll draw this. We're going to put the rectangular wire that we put in the, you've got bracket slots on these people that fit out like that, you know, on the teeth. Now, if you want to widen the upper arch like this, you've got to put torque in there, and you twist this torque so that it's pushing the root of the tooth. In other words, you got a tooth sitting in here like this, and the root's going up here, something like that. And we need to push the roots out in this direction with this rectangular arch wire. Now, if you put torque in it, just put your fingers up like that. What am I going to have to do with this to make those roots go out? You tilt it this way. So you're going to have to bend the arch wire way down like that, and then you pull it up, and the arch wire wants to pull it down in that direction. So making the arch wire to go in there, I bend the end of it up. That's going to look like that. And now you catch it right behind the cuspid tooth right here with a pair of pliers and hold it real tight. And you twist this wire till that tail end is nice. Say this was straight up down, till it's straight out in this direction, see. Now, that's progressive torque. It puts less over here. You twist that wire, and now you've got a bracket slot, but your wire has got a bend in it like that. You twist this wire, stick it in that slot, and it tends to make the roots go out that way. Now, if you don't have something strong on here to bring it out, instead of the roots going out because they're in cortical bone, the crown will go in when you put this type of torque in it. So you've got to come in now with this big wire, and then you pull it in and hook it to that, and you can get all the lateral force you want here. And now the tooth will widen, and you carry the roots out at the same time you take the crown out. And when you do that, you expand the airway on the person. And I look at some of the appliances that are being sold to people, or people that don't realize that putting some round wire in here, they'll put something in here and push this tooth out. Well, what happens? The crown goes out, it's in the air, and the roots are in the bone, and those teeth, they'll push this out. The bone actually, the tooth will rotate somewhere around in here, and the roots will go over to the side or inside and actually mess up the airway even more than it is. So they need to learn how to put progressive torque in that. So this arch wire coming around the teeth now goes like this, and it puts less force on the bicuspids than it does on the molars. And you can expand somebody's mouth. I don't care how old they are, what race of people they are, what color their skin is, whatever it is. You can expand anybody's teeth as long as they're alive. And that's a fact. And we have been taught in the orthodontic school that you can't straighten adults' teeth and you certainly can. And you can widen adults' arches. And we have developed a system here we call straight wise that can move teeth any direction you want to move them, anywhere in the mouth. I don't think you could come up with some movement of the teeth that we can't come up with and show you a way that straight wise orthodontics can move the teeth any way you want to in there. So this is out with adults or children. So you look at a child and you need to get their airway widened if you possibly know how to do it. You can do it on anybody if you learn how. I don't care how old they are, even kids or anything else. But you need more than push it out with a thing inside here, pushing out the teeth back here. The major bone is right here. And you need to get out here and put something in this area where you're pushing here and here, and you can straighten, you can separate the palate on people up in their 30s and some people in their 40s, and you can widen their arch on anybody. It just stretches the palate. It'll drop back some, but you can stretch and move it out on anyone. And I've shown that in cases. So I thank you for watching, and just, it's hard to get across the effect that mouth breathing has on somebody. Mouth breathing, you suck the junk in. If you breathe it through your mouth in a dusty area, your mouth filters out the junk going through there. If the turbinates and the little cilia are working right, they stay moist. And I've worked stacking hay, and you'd go outside and suck in like that and spit, and it'd be all dirty because you're breathing so much dust in there. Mouth breathing is a healthier way. Now I realize when you run and you're really exercising, you have to breathe through your mouth because you got to get all the air you can possibly get in. But under normal circumstances, we ought to all be breathing through our nose, and we filter the air. It warms it up to you, mouth temperature, body temperature. It carries the air through with some volume in it, and it goes out into the alveoli of your lungs. And the blood oxygen is better if you're breathing through your nose than it is if you breathe through your mouth. Because when you breathe through your mouth and you're just sitting there, you suck the air down with hardly any volume or any speed to it. The nose makes you suck it a little faster, and it goes out into the alveoli. So I've said a lot in this video, and it's hard to get this across to people. You can separate the palate on anybody as long as you use the rectangular wire and put the torque in it. Now on the bottom, the torque is opposite of that. And on the bottom, you want to do something that bends the roots of the tooth out as you spin. Up here, you want to bend your wire, and it's wanting to carry the roots out. And you put that on, and you put the big wire up there. It won't let the crown go in, so the whole tooth goes out. And when you expand it, you make sure your tooth is going with this. You look down here, if this root starts separating this way, then you've got too much force on that and not enough torquing force. So hopefully people can decipher what I've tried to put across here. I know it's not plain as day, but that is the facts in here, and that's the truth of it. And people do not know that, and they're not taught in dental school, as far as I know. So I'm going to say goodbye and sign up. This is going to be a long video, and people will thumb through it But if you want to learn orthodontics, you're going to have to study these videos. And we've tried to get the information there, but it may be mixed up and hard to decipher out. So I'm going to say goodbye. And even the people in our own organization, many of them do not understand that. And so this goes out all over the world. You're going to have to study this video. If you can learn that, you've learned a lot in orthodontics. Thank you now, and I'm going to sign off. And I'll close that. I don't know why it didn't do anything.